Hey, welcome back to Not So Complicated. And today we are doing episode 8 of 5 minutes 5 high yield drugs. This is coagulation, or like we are doing hematology, including heparin, warfarin, ferrous sulfate, hydroxyurea, rivaroxaban, right? So let's begin without further delay. The first drug we have is heparin. It belongs to class anticoagulant parenteral. The uses are deep vein thrombosis, pulmonary embolism, acute coronary syndrome. To dissolute this embolus or thrombus, that is a clot-like structure, you have to dissolute this. That is why we have to use anticoagulant. The mechanism of action is that it enhances antithrombin and inhibiting factors like activated prothrombin, that is 2A thrombin, and also 10A. The side effects of this drug is bleeding, osteoporosis, and heparin-induced thrombocytopenia, which is very typical for this drug. So you have to remember that, right? So the USMLE poll for heparin is that we have to monitor APTT, that is plasmin thromboplastin time. You have to monitor that, right? And it can be reversed by protamine sulfate, which is antidote for heparin toxicity or heparin overdose. Protamine sulfate, this is very high yield and you have to remember this. And the other drug we have is warfarin. It is vitamin K antagonist, also anticoagulant. The uses are atrial fibrillation, deep vein thrombosis, and mechanical heart valves, right? So the mechanism of action of this drug is that it inhibits vitamin K epoxide reductase, reducing clotting factors 2, 7, 9, and 10. 2, 7, 9, 10. That is how you remember. 2, 7, 9, 10, right? It reduces clotting factors like that. And the side effects are bleeding, teratogenic skin necrosis. So you don't use warfarin in a pregnant female because it has teratogenic feature. So the USMLE poll for this drug is that we have to monitor international normalized ratio of PT, obviously, and then you can breeze with heparin during initiation. You can coincidentally use warfarin and heparin during initiation, right? The other drug we have is ferrous sulfate. It is iron supplement. The uses are obviously iron deficiency anemia, chronic blood loss. The mechanism of action of this drug is that it provides elemental iron for hemoglobin synthesis, restoring red blood cell production. The side effects are GI upset, constipation, nausea, and also dark stools. So what actually happens is if you prescribe iron supplement to the patient and the patient returns 2 to 3 days later complaining of dark stools, so you have to ensure them that this is not a clinical side effect and it will subside when you stop taking iron supplement, right? So the USMLE poll for this drug is you have to take with vitamin C to enhance absorption, and antacids actually reduce the absorption of ferrous sulfate, and that is why we have to avoid the use of antacids along with ferrous sulfate, right? The other drug we have is hydroxyurea. It is an anti-metabolite. The uses are sickle cell disease, chronic myelogenous leukemia, CML. We have talked about it in our hematology section of pathology, step 1 first aid, right? Line to line. If you haven't watched the lecture, you can go and watch. And then the mechanism of action is that it inhibits ribonucleotide reductase enzyme and thus reducing DNA synthesis, and thus it increases fetal hemoglobin. It increases fetal hemoglobin, that is HbF, right? So a normal person has hemoglobin, mature hemoglobin, adult hemoglobin, but it increases fetal hemoglobin. The side effects are bone marrow suppression, GI upset, and skin hyperpigmentation. This is a typical finding, and a patient presents with skin hyperpigmentation if it is an anti-metabolite, right? And if the patient has a sickle cell disease. So the USMLE poll for this drug is that it reduces sickle cell crisis by boosting SBF levels. So there are 3 different crises for sickle cell, right? There are three different crises. This is your splenic crisis. This is your work to do. Comment down what are the crises of sickle cell anemia. And the last drug we have is rivaroxaban, and it is that direct oral anticoagulant, factor XA inhibitor, and the uses are non-valvular atrial fibrillation, deep vein thrombosis, and pulmonary embolism prophylaxis. So the mechanism of action is that it directly inhibits factor 10A, obviously, and thus preventing thrombin generation. How? Because this factor 10A is the initiation of common pathway of coagulation cascade, right? So that is how it prevents thrombin generation. And the side effects of this drug is bleeding, that is no routine monitoring is needed. The USMLE poll for the drug is that you have to if there is toxicity of rivaroxaban, or if you have to induce coagulation, then you can reverse it with andexanate alpha or PCC in emergency cases, right? So that is all for today. Subscribe for daily doses like this. Thank you for staying with me.